to see that 18 different positions in acupuncture, which among them sometimes having the dilemma about the confusion status to understand about the etiology and pathogenesis of the diseases. In that particular situation, sometimes the part to part how we can able to identify and recognize our system to understand about the pathological diseases. Number one, we wanted to see that, so there are the few places which I told you, especially on the temporal region. So we wanted to see about the head and neck, especially the ear region. So there is a pulse called as a temporal artery pulse. So that pulse is located very anterior region to the tragus of the ear. There are the 3 points are located. One is the Tungsilio, that is the Tinkang, Tinghui, and then Armen. So this particular point which we call as the small intestine, 19 point is located over here. So that area to be known as a temporal artery pulse. So this pulse is indicating there is some kind of the issues with the ear system and also temporal region, where the enough amount of the blood is not passing to the head region. We try to understand by using the palpation of this particular region. If this region is, the pulsation is good, then we understand the auricular also good, at the same time the temporal head also good. Right. When we wanted to see the next pulse to be known as a carotid pulse, that pulse is exactly located midway between the organs of it, that is called as a trachea, and then the SCM muscles and sternocleidomastoid muscles. You look at, this is the SCM muscles and this is the trachea or organs of it. Midway between these two, this point to be known as a REN in. This point to be known as a REN in. So this particular region we try to palpate for the carotid pulse. If the carotid pulse is good, then you understand which is passing to the head and neck and then brain from the heart. So therefore you understand when this pulse is indicating is the good quality of the pulse and force and rhythm and tension and volume is good, then you understand the head region which is passing to the head and neck, of course, and the brain. Definitely that will be really useful to understand about the any pathology is there. If there is no carotid pulse we can see over here, that's indicating some kind of the issues in the head and neck and then brain region. The next pulse to be known as a brachial pulse. So brachial pulse is located on the chusa, that is the pericardium 3 region. This is the cubital fossa and then cubital tendon. Medial side of the cubital tendon. So this is the medial side of the cubital tendon. So this particular region which we call as a pericardium 3. So that's the reason when we wanted to apply the needle on the pericardium 3, so it's not recommended to apply until beside of the artery should be applied this particular point. So if this is indicating there is the upper extremities, especially its functioning or not, precisely the brachial muscles and also other muscles are functioning good or not, we try to identify by using this particular pulse. Right. The ulnar pulse is exactly where the Shen-Men point is there. So this particular region is the ulnar pulse. We all know the radial pulse are reflecting on the thigh yuan area, where at the base of the thenar eminence of the palm. This area is the thigh yuan point, LU9. Normally we used to see in acupuncture, there are the 3 locations, keep it in your mind. Number 1 is the Li Chu. The second one is a Chin Chu. The third point is known as a thigh yuan area. There are the 3 areas we normally place the fingers, but however we try to find out, this is in fact is totally different scenario, because when the pathology or etiology positive factors from the internal organs that reflect on the radial artery on the 3 different divisions. So one division known as a LU7, the second division known as the second division is LU8, the third division known as a LU9. So once we place as a surface level, that gets indications are different. The deeper level indications and then organs are different. But however, this radial artery also very, very imperative to understand the pathological defect according to Chinese acupuncture. But at the same time, we wanted to the ulnar now is affected. Then we try to find out from this region at the same time on this region, especially on the base of the ventral side of the wrist, transverse wrist crease. So now we wanted to know there are another meridian, another particular area to be known as a femoral nerve. Femoral nerve is located especially 3.52 lateral to the center of the midline, and then from there 3.52 lateral from the pubic bone. Then you understand the point name is Chungmen. Chungmen is the spleen 12 area. The spleen 12 is the good point to understand about the femoral nerve. If the femoral nerve is good, then the lower extremities which is passing to the normal direction to the hamstring muscles and gracilis muscles and then adductor and abductor muscles descending direction, that indicating that femoral nerve is good, then these muscles also good, and then lower extremities also good. Then we wanted to find out the another pulse. That's the reason we should not apply the needle on that region. This is only for the recognized pulses about the pathological defect. Is not that we should puncture over there, because the Chungmen, Fu Chi, Fu Shi, Ta Hen, Fu Ai. So these are the areas which we call as a spleen 12 and then spleen 13. Midway between you are going to get the display femoral nerve, femoral artery and then femoral vein. So there are the three places. Only on that particular region you can find, especially which is located, this is the navel, from the navel downwards direction, 5 chun distal to the navel and then 3.5 chun lateral to the navel. You understand, from the central line, you can find this particular region bilaterally. If there is some problem over here, there is some blockages on the femoral nerve and then femoral artery, then you understand the lower extremities will get issues over here. So we try to find out that nerve is popping, that pulsation is there or not there. If the pulsation is not there, then definitely avoiding that nerve and then artery, you just apply the Chungmen. Chungmen is very close to that particular point. Make sure that you should not puncture that. Right? In order to activate that nerve, we can use it over this region. At the same time, when we wanted to see the popliteal artery, popliteal pulse, which is located on the posterior side of the knee region, but now you understand this is the chutney, is the patella. So behind the patella, which we call as a popliteal fossa. So in the popliteal fossa, you can find the diamond-shaped hollow. So that hollow is indicating the weight chung, that is a UB40. So UB40 point is exactly located at the center of the popliteal fossa. There you just place the finger, there you can find out anything connected to the posterior side of the leg, which is passing the circulation of the energy to that particular region, which is descending from the posterior side of the thigh region. If there is some stagnation or stenosis, or there is the Baker cyst or the popliteal cyst is there, so that particular time that also get stagnation or stenosis or blockade. So that particular region, if it is not finding out that popliteal pulse, especially this particular region. So you understand that this is the center, but this particular region, you try to find out the popliteal pulse. If you are not finding here, you just pass on to some different position, especially on the popliteal crease. So this is the area of the popliteal pulse. So this is the strengthening. If you activate this also, because you understand the deeper level, you should not penetrate this point, because a branch of the there is another artery to be known as a posterior tibial artery. So posterior tibial artery, and the posterior tibial artery, which is located on the pericardium kidney 3, Tai Chi. So this particular region, due to that reason, when you wanted to apply the kidney 3 point, but here you should not damage the posterior tibial artery. So once you damage that, again will be the damage, you are collapsing to that nerve and then artery. It's not recommended. Right. So this also very much essential to understand about the lower extremities and then talus bone, and then the ankle region where the blood supply is passing precisely or not, we will come to know by using the posterior tibial artery. The last, but at the same time definitely it's not the least, but which we call as a dorsalis pedis artery. So that artery is located exactly, there is the Chixi and then Chungyang, that is a stomach 41 and then stomach 42. Where exactly? On the stomach 42, nearly 1.5 chun distal to the stomach 41, you can find the dorsalis pedis artery. So this artery also good. This is the branch of the anterior tibial artery, but this is passing to the entire region of the toes and also to the feet as well. If there is some kind of the deformity here, but the flexion and extension of the knee, at the same time flexion and extension of the ankle region, that having a great difficulty. But however, a stomach 42 Chung Yang point is there. That point is you should not damage by puncturing this particular area, but try to avoid the dorsalis pedis artery and then apply the needle over that region. So these are the different kinds of the 9 different kinds of the pulses that will be really useful to understand about the pathology of that particular area is functioning precisely, that particular muscles are functioning properly or not. We try to analyze based on these principles. But however, we do have a lot of information regarding the radial pulse. When we have the confusion, that time definitely we can take the advantage of these different kinds of the pulses as well. Thank you. So anything else?